I've been a social worker for 33 years, mostly in the Houston area, working with catastrophic injuries, primarily neuro rehab. And breathe. And it's one of those things that you can do in whatever setting. You're stuck in traffic, you're now going to be late for that doctor's appointment or whatever it is. Or late getting home and the caregiver that you're paying is now gonna get double time pay or whatever. Breathe, just breathe. Because what happens when you don't? You tighten up maybe, or your stomach starts hurting, or you get irritable, you start getting more angry. So just taking that nice, slow, deep breath, and usually, 3 good ones, and then go, okay, what can I do? What do I have control over, and what don't I have control over? And that's a big thing. You don't have control over how someone responds even. I need to bring up that they are bringing negativity to this conversation when they care for me. So you need to bring it up, but you don't have control over how they respond. And you don't have control over some of those logistic things too. You don't have control over the traffic. You don't have, some of those kind of practical components. So what do I have control? So breathe. What do I have control? What do I don't have control? What can I do right now? How can I stay in the here and now? I can't go back and redo the past, and I can plan for the future, but I can't know what the future is. So how do I stay in the here and now? What do I do? And then that fourth one, which I've already talked about before, is know your resources and use them. Know your resources of how you communicate, to knowing your resources as to who could be your support group, who could be your person who exercises with you. Make sure you have outlets, that you find ways to have joy, whatever it is that you enjoy too. Because what we know about patients and caregivers when we ask about what quality of life, what is their quality of life? And when you look 5 years out, and I say this, if anyone who knows me is gonna in any way listen to this, they're gonna be like, here she goes again. But it's so important. When we do research and we look at outcome data, and you're more like 3-5 years out, not the first year out, but 3 to 5 years out. But you're still, you still have a major life event, a spinal cord injury, brain injuries, or, I'm sure with the elderly, dementia and those types of things. It's still there. So you have what we call ambiguous grief, perhaps, meaning that you're grieving something that hasn't actually come to an end yet. There's not an ending. And then when we ask what is quality of life, it isn't I am now walking, or I am now able to go back to work. Well, actually work would be, but it's not about walking. It's not about I can speak now. If they were aphasic, I can now speak. It is about feeling connected. So feeling that you belong within a group. You're not isolated. So feeling connected and being productive. Having value to your life. I'm not able to work anymore, but I found a gardening group and I garden and I am productive. Or I now help the kids with their homework. I used to not be able to when I worked. So that having value, having worth, and feeling connected. That's the quality of life.